sister was 10 years old, she started getting sick. She had sunken-in eyes, ashen complexion, and as you can see here, here's a picture of her. We were pretty worried about her, and my mom got a phone call from the teacher saying, "We're worried about her, she isn't moving around in her seat, you have to take her to the doctor." So she took her to the doctor, and the doctor didn't find anything wrong with her and referred her to an allergist, thinking it might be a food allergy. And took her to the allergist, and he said, "Well, might be celiac." And since we had never heard of this before, I said, "Okay, how do we know?" And said, "Well, the only way to know for sure is to get a biopsy of the small intestine." And he said, "But you can do an experiment, and that would be to go on a gluten-free diet for about 4 days to a week and see what happens." Well, lo and behold, we went on this diet, and she is 24 years old. It worked, and she is a thriving 24-year-old. And thanks to a lifelong commitment to a gluten-free diet, she can stay that way. Celiac disease, or gluten intolerance, affects many people each year. In fact, according to statistics in the Sylvia Bauer's book, A Guide to Living with Gluten Intolerance, 1 out of 133 people will be affected by this disease. This condition can affect anybody, but some people may not even know that they're living with this disease. I hope to explain this condition and how to live successfully with it. Many of you may know of people who are affected by this disease, or you have personally been affected. I hope to help you understand more about this condition and how to live successfully if ever diagnosed. According to James Braley, medical doctor, who is an expert on food allergies and gluten intolerance, and Ron Hogan, M.A., who is a celiac and respected writer on the topic, celiac disease is an ailment whereby the inside lining of the small intestine is damaged by gluten proteins and their interaction with the immune system. So in order to understand this disease, we really need to understand what it does to the victim. So first let's look at normal digestion. Food goes in, we get into the small intestine, gets absorbed, waste goes out. Now, celiac, on the other hand, food goes into the small intestine, and then that's where the problem happens. The villi get inflamed, and then after the villi get inflamed, you have little responses saying, "Foreign invader, intruder." And so if this continuously happens, then what happens is the villi right here, the damaged villi continuously get cut off. Here's a normal villi and here's the damage. And in severe cases, this villi is actually pitted. So there's no villi there at all, it's just pitted. So as Dr. Peter Green, director of Celiac Center at Columbia University, states, celiac is a disease of absorption. So that means that it's not absorbing the minerals that it needs to. So now that we've heard a little bit about celiac, how do we recognize if we have it? Signs and symptoms. Well, according to Emmy Emmerling, who is a certified adult nurse practitioner, author, and contributing editor for several nursing journals and medical publications, the following are signs and symptoms of this disease: abdominal bloating, diarrhea, weight loss, flatulence, iron deficiency, osteoporosis, infertility. Some people lose weight, some people gain weight, some people are constipated. You can read through these symptoms and see there are no regular symptoms of this disease. And the main reason why it is misdiagnosed or not diagnosed at all is because it mimics other diseases that are more common, and then also just because you treat the symptoms instead of the underlying disease. There is no cure for celiac disease. Now, saying that is scary, but there is hope. You can live a perfectly normal life if you have celiac disease by just going on a gluten-free diet. Somebody that's diagnosed with celiac disease, they just have to live a gluten-free diet the rest of their life. So what happens if you go back on gluten? You start eating wheat. Well, what happens is the same response as what was before. You start with the villi, it gets broken down again, and then you're at the same point as you were. So it is suggested that you not do that. There's only so many times where your body can adjust from gluten and then back and then forth again. So if you are ever diagnosed with celiac or you think that you may have celiac, you should go on the gluten-free diet and stay there, because we really don't have the research to know how many times you can go back to the gluten and still have your body adjust. The great thing is that there's naturally gluten-free foods. There is natural meat, dairy, vegetables, and fruit that don't cost any more than anything else. The bad news is any of your breads or your pastas, they're going to cost more. A celiac disease diet requires removal of all forms of wheat, rye, and barley. And according to Steve Helms, doctor of naturopathic medicine, within the first couple months of being on a celiac diet, you should also avoid corn, millet, sorghum, and oats. And this is just because of your natural body response to these. You can use caution in entering these into your diet after the couple months. And then a side note is cross-contamination. Even though something may be naturally gluten-free, you really have to be a label reader and make sure that what you are putting in your body is gluten-free, because cross-contamination happens a lot, and especially in the beginning. So in conclusion, at the start of this presentation I told you about my sister and what she had to go through. And hopefully with this information you can help somebody else or maybe yourself not have to go through this. 1 in 133 people will be affected by this condition, but it doesn't have to negatively impact your life. You can live a successful gluten-free life. Adjusting to a gluten-free life is not always easy, but there are many people, including myself, that have to do just that. Thank you.